Thank you for joining us on another edition of GBMC's Facebook Live show, To Your Health. I am your host, John Lazarou. Hey, did you know that men have higher mortality rates than women when it comes to heart disease, stroke, and cancer? And with June being the month of Father's Day, and it's also National Men's Health Month, and we're in the middle of Men's Health Week, we thought it was a good time to encourage men and the dads in our lives to, hey, make that annual wellness appointment and get yourself checked out. So joining us today to talk about that and also about a new venture that GBMC is taking on down in the city of Baltimore is Dr. James Baronis. He is a internal medicine doctor and a family physician with GBMC Health Partners at Joppa Road. Dr. Baronis.
Thank you for having me.
Oh, I appreciate you coming in. We got a lot of questions and good stuff to get to. So let's start off. Yeah, absolutely. So, in the beginning, I mentioned about cancer, heart disease, and stroke. I'm going to try to touch upon those during our show today. But, my first question for you is, what are the most common health issues facing men when you see those men in your practice?
So there's a lot of health issues facing men today. I think one of the biggest health issues, a simple place to start, is inactivity, which directly will lead to obesity. Obesity is obviously something that's in the news. We hear about it all the time, but for so many patients and so many folks, it's a difficult thing to deal with busy lives, work schedules, family, and everything else that gets into it. Obesity is a big thing, which then can lead into things like blood pressure, diabetes, and other things. And it still always stuns me, the amount of men that still smoke these days. But I think that's one of the big things we always try to focus on is, first and foremost, activity, exercise, and controlling your weight.
So you mentioned all those that that you normally see in male patients. So which leads me to my next question. Among those top issues you might address with a male patient during their annual wellness visit, what are some of those?
Well, I mean, first and foremost, when you're going through with your visit, one of the first things I always start with, and you look right at the chart, is your blood pressure. We want to make sure the blood pressure is good. Blood pressure can be a tough thing because your blood pressure in the office sometimes isn't always a great indicator of where your blood pressure actually is during when it could be at home. And you fortunately don't live your life in the office, though some of my patients, sometimes it seems like I see them a lot, but that's all right. But sometimes you want to get readings outside the office too. So I really look at blood pressure, always try to repeat a blood pressure later on in the visit if the first blood pressure seems like it's a little bit elevated. That's a big thing that we start with and focus on. And then really like to focus on, patients' overall weight and then their activity level. Some weight's just a number, it's an important number, but we do have some folks that, can carry a little extra weight but also be very active depending on their muscle mass and everything. So certainly exercise and activity is another thing try to focus on as much as we can.
You mentioned about lifestyle, but let's talk also about family history or genetics. Does a man's family history or genetics put him at risk for developing certain health issues or conditions or diseases?
Yeah, absolutely. I think for sure, for everything from, we talked about blood pressure to cholesterol. I have some patients, sometimes you'll get a high cholesterol level and we'll go through it and we'll try 6 months of diet and exercise. And sometimes they do a great job, they lose a lot of weight, they do everything we tell them to do, and they come back, cholesterol hasn't budged at all. Sometimes that's a frustrating thing, but usually it's, you're feeling better, you're looking better, sometimes that cholesterol is genetic and, you need a medicine or something else to try to help get there. So, that certainly plays a role. And, we try to take a good family history and go through everything just to have an idea of what risk factors we may need to focus on.
One of the things that everybody talks about, for example, when you get to a certain age, you need to make sure you have your colonoscopy done. So
sure.
Let's try to, if you can, just work with me on this. Give me the top 3 or 4 tests or screenings that a man should have to go through annually during their wellness visit after a certain age.
Well, annually during the wellness visit, I always like to do blood work. Blood work is important. It can kind of give us a good picture of where your overall health is. One of the big things for men is a prostate screening. So you want to do some sort of prostate screening, whether that be the digital rectal exam or do the PSA. Depending on the individual patient, sometimes you do both, sometimes one or the other. Some men just aren't going to let you do the digital rectal exam, so we stick with the PSA and do the best we can with that. So that's one of the big things that we do in terms of focusing in blood work. The colonoscopy is obviously something that we don't perform in the office. We would refer you to a GI doctor. We don't do that yearly. I'll check in on it yearly just to see kind of where your status is. That's usually something that you do about every 10 years or sometimes less, depending on what your doctor says. And some of that data is changing. We've always said 50 is the age for colonoscopy. We're seeing colon cancer more frequently in younger patients, so there's actually a push to move that age to 45. So we take into account your family history and other things. So those are some of the big things we talk about. I talked about some of the exercise piece and checking your blood pressure, making sure those things are okay, and following up on your weight. And then as if it's around flu shot time, we're going to push you for a flu shot. Those kind of things going forward.
Okay, so we talked about eat better, exercise more, but is there anything else that men can do that can help them see improvements in their health and the way that they feel?
Well, I mean, really, it's hard. It's really kind of having that dynamic exercise. We see so much stress in men's lives, all patients' lives these days, and trying to have a work-life balance. And we do focus a lot on that. I feel a whole lot of what I do sometimes is sometimes more psychologist, even more than doctor, in terms of promoting a good work-life balance, making sure that everything kind of flows together. Because many times, when you're going through something with a patient and you're kind of like, well, why aren't you exercising? Why aren't you doing it? It'll come back to some kind of stress, whether it be something at home and family life, or a job, or maybe a child that's sick, or something else like that. And so trying to tease out those things also is an important thing, and definitely something you want to talk to your provider about if there could be something else that's holding you back.
Joining us today is Dr. James Barones, family medicine physician with GBMC Health Partners at Joppa Road. Dr. Barones, again, I want to thank you for joining us here today and providing us some great information. For those of you in our audience or watching us on Facebook, if you have a question, please submit it online in our comment section, or if you're in the studio, you see Laura over there. She's standing. There, nice job. Nice wave, Laura. Please give your question to Laura, and we'll have Dr. Barones answer it. Doc, in the beginning I mentioned about cancer, about men having higher rates than women when it comes to cancer, but of course specifically for men, let's talk about prostate cancer.
Sure.
And testicular cancer.
Yeah.
So what are the chances of men developing either one of those cancers?
Well, most men, if we live long enough, we probably will have some prostate cancer cells. There's all kinds of different literature online about that, but most men, by the time they're 80, it's kind of the 80-80 rule. About 80% of men by the time they're 80 will have some sort of prostate cancer. Prostate cancer usually, fortunately for most people, is slow growing. So we get to a certain age, and sometimes we just stop screening about it because we think, you're probably, chances are something else is going to get you. But we take it case by case. People are case by case. Yeah, there's, obviously, for that, and we follow when you look at the national screening guidelines, they don't apply to every patient. And I have some folks that walk in and they're 90 years old, and you're just like, you look like you're 70. And so, if I think they're going to live a lot longer, I'm like, hey, it's not necessarily recommended to do this prostate cancer screening, but I don't think there's any reason not to. Let's keep going and go from there. So really, you take it case by case. So prostate cancer is definitely something that we're pretty focused on and want to keep an eye on. The PSA kind of went through different variations. First it was a good test, then it's a bad test. Now it definitely is something that we play a role in. Try to work hand in hand with the urologists. A lot of men will have sometimes already, even by the time they see us, will have a urologist to try to give the best care. And we're looking for levels, and that's why it's important to do, again, some kind of screening at least every year. Testicular cancer is usually it's more of a younger man's disease, though that we can see that sometimes as you get older. Specifically, we don't do as many testicular screenings as you mature as we do prostate cancer screenings. We always try to offer it. But it's really important for men to do self-testicular exams. We say usually quarterly or at least 3 times a year you want to do a self-testicular exam, make sure you don't feel any new lumps or bumps or something that's, feels different.
You mentioned about prostate cancer. So what are some of the things that men can do to improve their prostate health? And also, are there any other type of cancers that men should be concerned about?
Well, certainly one of the big cancers not to overlook, and I'm not going to step too much on my dermatology colleagues' toes, is skin cancer. Skin cancer is just so common. You definitely want to make sure that, you're having someone, check your skin, at least once a year, wearing sunscreen, doing those kind of things. Sometimes we find randomly when you're seeing a patient, you're just doing a review and you're like, hey, what's this? How long's this been there? That's something that you want to think about. For your prostate health, really, if you look at most of the studies and most of the literature, it's really being healthy. It's eating healthy, eating kind of a low animal protein diet, eating, healthy vegetables, being active, exercising, keeping your belly fat down, your weight down. Those are what seem to be the most effective things, for prostate cancer. And then especially, if a family history is something, in your family, we're going to be a little bit more aggressive in, screening you going forward.
Again, joining us on To Your Health is Dr. James Baronis, family medicine physician with GBMC Health Partners at Joppa Road. We actually, before we get to the question from our audience members, if somebody wants to make an appointment to see you or one of your colleagues, what's the best way to request an appointment?
So probably the best way these days is to go online at gbmc.org/Joppa Road. That's where me and my colleagues work, and we'd be happy to see you.
Awesome, great. Laura, you have a question for us?
Yep, we have got a question from our studio audience.
Fantastic.
Doctor, I agree 100% with you about the obesity problem in this country, and I don't think it's getting any better anytime quickly. One of the things that was frustrating over my lifetime is that on a weight scale, typically the life insurance companies would dictate what those numbers are based on height and so on. And nowadays, when you leave the doctor's office, not only you get your weight, you get a BMI, body mass index.
Yes.
I'm just curious why BMI is not necessarily adjusted to the person's age, because I think, from a personal perspective, I don't think I'm overweight, but I look at the BMI they get when I meet the doctor. I'm just on the borderline of, I won't say obesity, but it's very questionable to me, that parameter.
No, I agree with you. I don't always love BMI personally. I know a lot of people use that for a lot of things, and that's kind of one of the things a lot of people hold on to. And I have patients that say they're obese, and they're some of the biggest, most muscular guys that you could see, and well-trained athletes that'll go over there. So the BMI is information, just like the weight number is information, and you kind of put it all together and try to decide what's best for the individual patients. But I agree, certainly as we mature and go forward in life, sometimes I don't feel that those BMI numbers always exactly match, where you are. It'd be more important for me, how active you are you exercising, what your numbers are showing, if your blood glucose is fine, you're not near diabetes, your blood pressure is good, and maybe the BMI number says you're in the overweight range or a little bit higher. I'm not, I'm going to encourage you and, say continue to eat healthy and do what you're doing, but I'm not going to push hard to be focused on, that BMI has got to be less than 25, depending. So it's very patient dependent, and there are some patients, for other health conditions where I will kind of say, we really got to get this down because of that. But yeah, it's not always the end all be all, attached to it. And unfortunately, yeah, insurance companies and sometimes even both health insurance and life insurance companies will attach maybe more significance to it than I think we do in the medical community.
Can you outline some of the nutritional guidelines for men and how they might age, how they might change as men age? And again, that was an excellent question from our audience member. Can you just talk about that?
Well, I think one of the big things, and we'll get into a little bit of food nutrition, but one of the big things is also hydration. I feel like these days there's a lot of folks they just don't drink enough, or consume maybe necessarily the wrong things. Not that coffee's all bad, but you really should be hydrating enough and that can, a lot of times when we see people come in fatigued, energy, and that can be more difficult for a man sometimes because as your prostate gets bigger and you hydrate more, you have to go to the bathroom more, you have to urinate more. And so I do see a lot of men sometimes that start cutting down their hydration a little bit at the detriment to maybe your kidneys and other things. So don't want to forget about that portion. Certainly as we go forward and we mature as men, our metabolisms can change a little bit and can slow down, and it becomes more and more important to really focus on leafy green vegetables, kind of cut down some of the animal protein. Not all protein's bad, but to really try to have a more well-balanced diet. It's also very important when you eat, you want to be eating more during the day when you're active and not save most of your meals to at night. It's tough not sometimes to snack at night, but those calories a lot of times, your body will just turn them into fat, and it's basically a lot better if you're eating most of your regular meals during the day. And it really varies per patient and based on their activity level of what they're doing in terms of exact calorie guidelines sometimes is tough. A lot of people these days are using apps to help track calories. I found that to be very helpful for some people. You can plug in your meals and have kind of come up with what a weekly calorie goal could be. And so sometimes you can eat a little bit more on a Saturday and maybe a little bit less during the week to have a couple good meals. But really, there's no real one secret with the diet. It's really trying to be well balanced and adjusting for as we mature in metabolism, slowing down a little bit.
Now, we got a couple of questions that came in before our program with a nutrition and diet focus, so let's get to them real quick. I'm going to start off with Ben. Ben asks, what should we eat daily and how much water can we drink daily?
Well, there's not really, you can drink too much water in thery.
It's called drowning.
Yes, yeah, that's very true.
You're not just the only funny guy here today, let me tell you. All right?
So most people say about a half gallon a day of water is probably about a good thing to shoot for. If you go online, there's the 8x8 rule. 8 ounce cups a day is kind of what you do. But you should be continuing hydrating over the course of the day. And it is important to try to do. There's a lot of these diets out there, and people have varying degrees of success with it. But it is good to eat. Have a solid breakfast, have lunch, and have dinner. Try to eat 3 times a day at least to be healthy. Obviously, you can spread out with some snacks here or there, and it can be something as simple as a protein shake or something for lunch. But I like those a lot for snacking. I'd really tell a lot of patients that are struggling with their weight, give yourself an out. Give yourself have something with you that you can do instead of stopping on the home McDonald's on the way home or those kind of things. To just have something you can do to hold me out. Now I'm the same way. I try to give myself an out because on the way home after a long day of work, sometimes it's the easiest thing.
Now, I have a kind of a longer question. Hopefully we can provide a shorter answer.
Sure.
Well, yeah, and it's kind of tough because
verbose,
when we have people asking questions that they're not patients of yours, it's kind of hard to give a synopsis. So we'll do the best we can here.
Sure.
You'll do the best you can.
Yes.
Here. Robin asks, my husband is 32 and has thyroid issues that he takes medication for.
Sure.
He's also significantly overweight. Is there any connection to his weight gain and his thyroid condition? And if so, what is usually recommended to get patients with similar issues on a path to a healthier weight?
That's a great question. So it depends on what that is. Is your thyroid issue well controlled first? I mean, that's the issue. Certainly a hypothyroidism can mean your thyroid is not acting as well as we'd like it to be, not giving off as much thyroid hormone, can cause weight gain and fatigue and many other side effects. So if that thyroid medication is not high enough and he's still technically hypothyroid, then you're probably going to struggle with getting the weight off. If the thyroid is kind of a normal thyroid, a lot of people are always looking for a thyroid problem. It's not always there. But if it looks like this thyroid levels are controlled, then it really goes back to more of the same. Because if you're taking a thyroid medicine, then in your thyroid that would basically hopefully put you to where your thyroid's fully working. You would just be doing the same thing with a healthy diet, with exercise. There's a lot of great groups in the area. I've had people that have done stuff with buying food, Weight Watchers, other things. Really, you got to find something that works for you and stick to it. But exercise is such a vital piece for weight loss.
One last submitted question before we get to another question from our audience. Chris asks, if the blood sugar level is controlled, do you think it is enough to prevent vascular complications?
Well, that's also, so vascular complications come from many different things. So having your blood sugar controlled is definitely a very important one because we know that elevated blood sugar diabetes can certainly lead to an increase in cardiovascular issues. So that's a big piece of it, but also you need your cholesterol, you need your blood pressure, and other things is a part of that. But yes, having your blood sugar controlled can be really important.
Again,
it is really important.
Again, joining us today is Dr. James Barones, family medicine physician with GBMC Health Partners at Joppa Road. Dr. Barones, we do have a question from an audience member.
Yeah.
Okay, so we actually have 2 questions. Just want to double check the mic is good. Okay, we are good. So the first question that I have is, are there any safe over-the-counter medications? Oh, there we go. Okay. Are there any safe over-the-counter medications for urinary and prostate health?
So there's 2 parts to that: safe and effective. So the big thing for a lot of people is saw palmetto. A lot of people are taking that. If you kind of read through a lot of the literature and the studies done, it hasn't necessarily shown to be significantly effective. Some people have side effects, most people aren't. I do have a number of patients that take that medicine and say it's effective and works well for them, and so I'm not telling them necessarily to stop, but that isn't necessarily something that I am actively promoting. Most of the time, if you are having prostate or urinary issues, I'm going to be thinking more of other medicines, or working with the urologist. The urologists are doing some new procedures these days and other things sometimes that can be really effective for prostate and urinary symptoms. So sometimes I'm actually making a little quicker referral to them than I have been in the past. But yeah, so there are things that for most people are safe. How effective they are, I think, depends on the person and what I guess the effects that they get from it.
Okay, great. So our second question is, what is the best test to prevent AAA?
The best test to prevent AAA. So but they're basically saying an abdominal aortic aneurysm is, I believe, what they're referring to. So that's usually an ultrasound. That's usually what we would do. Now, sometimes people will get CAT scans or other things for various reasons, and that'll pick that up. But for if you're doing a screening test, usually the easy test is to do an ultrasound, which would show if you do have some sort of aneurysm of your aorta, and that's obviously non-radiation, so we like to do that test. So that's in some men, we do that depending on risk factors, and there is a recommendation as men mature to consider doing that test.
So, Dr. Burns, believe it or not, we're almost wrapping up our show. We talked about, in the intro, I mentioned the clinic in downtown in
very
Baltimore.
excited about being a part of that.
And being a part of the Helping Up mission. So if we can just educate our audience about our initiative and what we're doing down there and why, that would be great. So can you tell us a little bit about the work GBMC is doing via this new primary care clinic to provide medical care for the residents of the Helping Up mission?
Sure. So Helping Up Mission is a spiritual-based recovery center in Baltimore City. Right now they have the capacity to have about 500 men who are struggling with different types of substance abuse, and 50 women at another location, and actually they're building a new women and children's center they're going to break ground on soon for a 250-bed women and children's center or so, which is amazing. So it's a great opportunity. Helping Up Mission has been looking for a health partner, and GBMC stepped up to the plate, which is wonderful, and they asked me to be involved as the medical director down there for that office. So we're very excited to be down there, me and some of my colleagues, and we have great support. And basically providing primary care. The goal is to provide the same primary care we provide for all our patients in a patient-centered medical home environment for the clients at Helping Up Mission, and to help them as they get through their addictions and substance abuse and get them back into regular life. And healthcare is such a big piece. So many of the men down there are not only struggling with those addictions, but other regular medical health problems, or have been out of the medical system that sometimes can play into it. So we hope to get them back into the system, and actually after they finish their time there, we hope to keep them on as patients and continue to see them as they transition back into society. So we're really excited about that. We actually opened the clinic yesterday, a brand new clinic, and we're really excited to be down there.
We talked about providing primary care for men who've battled chemical addictions. What are some of the side effects of these patients face when they're trying to conduct what we call a lifestyle reset?
So it's very difficult, because I think for a lot of people, after you've gone through these, first and foremost, in terms of their primary care, you've just ignored all of the things in your life. And so sometimes it can be difficult, whether it be struggling with other kind of chronic pain or diabetes or obesity. Smoking is such a big thing that working on those things to put them in a position to get back and to succeed. And then just supporting them in their mental health as we go through there. Now, again, the mission has great support, spiritual support, counseling, and everything else that they need in our partnership there with Hopkins. But we're certainly, that's mental health is something we deal with every day in the front lines in terms of your primary care health, and so a lot of that will apply when we're working with them. So we're excited. We're excited to be a part of it.
I know that it just opened up yesterday, but
yeah.
Maybe you can give us a little bit of a forecast. What do you see some of the challenges, and what do you hope some of the successes will be in our involvement with the Helping Up mission?
Well, I see certainly some of the challenges are for us are going to be keeping the clients with us. After they go through the mission, we want to have their health care not stop there. Other challenge sometimes is, making sure we meet them where they are, getting, other medical, history and other things from other places, as a lot of folks have bounced around through different places over the years. Success is, really is, to provide them the same level of care as we would of anyone else, and, making sure that their health isn't a detriment or anything that's holding them back from the changes they hope to make for their lives.
I want to commend you and your colleagues for taking on this endeavor at the Helping Up mission, and we look forward to hearing some successes in the next couple of years and during our time there. So we're going to get to the fun part of our show today. Of course, this whole thing has been fun, right? I mean,
always, it's great.
You did a little improv comedy, so did I. It's been a lot of fun. It's been something different. So we're going to get to this segment that we like to call True or False.
Okay.
Okay. I'm going to ask you a couple of questions, and in 10 seconds or less, try to give a nice, clear response, okay?
Sure.
All right. Top 5 answers are on the board. No, I'm kidding. Okay. True or false? Men are less likely than women to go to the doctor.
True. It's very difficult to get men to come to the doctor, and I thank all those women out there in their men's lives who are dragging and pushing and screaming your husband or significant other or father to the doctor. It's much needed.
Get your wellness appointment. Get it with Dr. Baronis or one of his colleagues at GBMC Health Partners at Joppa Road. But make sure, men, you get your annual wellness visit done, and done soon. All right. Unlike women, men don't require bone density screening.
That's false. It depends on the patient and depends on the situation. And there's some different guidelines that say don't screen men, and other guidelines that say do screen men. So it's not a blank. It's definitely not a blanket. No, it's definitely false. There are some men that, for various conditions, it is good to screen their bone density. So we definitely do that.
All right, 2 more questions. Men should start regular doctor visits in their 30s.
That's true, and I do think that it's important. I always tell most of my patients that it's good to have an idea what your cholesterol is by the time you're 30, and just some of those baseline labs just to kind of have an idea of what's going forward. Because again, I could tell folks sometimes that I have healthy marathon runners sometimes with high cholesterol. It's just kind of genetic the way it is, so it's good to do that.
I did not raise my hand when you said that. Having too much abdominal fat puts men at greater risk for a number of conditions.
Absolutely, that's a true statement. So it's something that's a struggle, I think, for all of us men, and that's where we store fat as we mature. It's kind of the way it is, but it does put you at risk for a number of health conditions, a lot of which what we've talked about today. So it's definitely something to work on and to keep battling. And again, it's encouragement. You take the small victories, and it's a pound at a time or an inch at a time. That's what we do, and you'll get there.
Do you believe that our time is up?
It's amazing.
It's
it goes
amazing.
By so quickly.
A lot of great information, Dr. Baronis.
Hopefully it was helpful.
Yeah, no, most definitely. I want to thank you for joining us today. But stand by as the conversation continues on Greater Living Live with Mary Beth Marsden, who's standing right over there. Hi, Mary Beth. How are you?
Hi, great.
One time I'd like for you to take the mic and ask the questions from the audience. I'd like that.
Sure.
Maybe next time, maybe in August. We'll see. Speaking of August, so yes, there's no show in July. We are taking a break to re-energize and get ourselves right. We'll be back on August 14th with To Your Health and Greater Living with Mary Beth Marsden. I want to thank you all again for watching us on Facebook and for our studio audience. And without you guys, the last 2 years would not have been so successful, and we're really looking forward to year 3. Before I do our outro, I do want to send out some special birthday wishes to my son, Theodore Anthony. You said that you haven't made it until the name leaves these lips on this show, so your name has just left these lips onto your health. So now you've made it at the age of 16. So there you are, son. Anyway, again, I want to thank everyone, and one more time, cheers.
Cheers.
And to your health.